My name is Clare Mullen, and I would like to acknowledge the ongoing and traditional custodians of the land I'm joining you from today, which is I'm joining you from Wajak Noongar country. I'm going to talk to you a little bit about the experiences that at Health Consumers Council we have had working with the WA Department of Health and the WA Primary Health Alliance that in Western Australia manage our primary health networks to represent, promote and support the voices of people with lived experience when planning services in the areas of early intervention and management of overweight and obesity. Next slide, please. So the compelling idea that I was wanting to share with you and leave you with is one that may be familiar to many of you from other areas, but is really nothing about us without us. And this is a phrase that might be familiar from other sectors, but really what it means is that if you're designing services, that it's about talking to people and working with people, not just doing to, but doing with in the design of those services. And the reason for that is you know, there's many reasons. One is that those services have a chance of being more effective because they've been designed based on a really good understanding of the needs and interests of people who will use them. Because of that, there's likely to be less waste of services because people may be more likely to use services that actually meet their needs and understand their contexts. And also because of that, then you're likely to see better outcomes for people who use services that help them achieve their goals. And we've heard some great examples already from people who are obviously taking this approach to their work. Like I said, we've been doing this with our partners since 2018, and I wanted just to share a few of the hows and the whats that are important, that have emerged as important to us. Like Louise and Andrew mentioned earlier, that really one of the main things that stood out for me from all the work that we've done in this area is the diversity of people's experiences. People's experiences that have taken them to this point in their health journey may differ, and also their individual needs and context that will differ as to what will support that person going forward. Because of that, we used a variety of ways to hear from people. For example, we did a survey that received over 700 responses. We had in-person focus groups. We've done online discussions. We have a Facebook group, and we send out regular emails to a mailing list of people who are interested in this area. So really, when engaging with people, as for any health topic, that understanding the diversity and responding to people's different needs and the way that people want to engage. As has been talked about, I think briefly before, because many people experience judgment and stigma in this area, and not everyone, but some people do, that taking the time to invest in building trust and relationships is really important. That can be about making sure that there's lots of opportunities for people to engage over time. But what that does mean is that the investment of staff time and money, because here in Australia people may be aware there is a policy of recognising the expertise of people with lived experience by offering consumer participation payments, and that's an important part of bringing forward those voices. What I would say about engaging with people and involving people with lived experience is that if you're doing this, is to be open to change yourself, because if nothing's up for change, then consider if you want to ask. And the second thing, and the final thing, is the opportunity to bring forward both individual stories, but then also drawing on other data. So, for example, the survey data that we gathered. I'm going to share just a couple of the pieces of feedback that we heard. In that survey, over 40% of people at the time had taken action to lose weight more than 5 times in the previous 12 months. But of that, only 15% of people had access to GP for support. And you can see that 9% had tried with a healthcare team and 9% had used clinical interventions such as surgery. And what we've heard is that people have a strong need, and we hear this consistently whenever we talk with consumers, ongoing, affordable services that respond to their needs. And that ongoing is really critical because we often see 8-week programs, 12-week programs, but actually, you know, the feedback is that people would like access to support on a much longer basis. Judgment, stigma, shame and embarrassment can be a barrier for some people to getting the right treatment. And I know that's certainly been something in my own experience that has impacted on me. And what we hear consistently is that many health professionals don't have the time that it takes to take a really person-centred approach and provide tailored advice. So I'll finish just by reiterating that kind of compelling idea, which is nothing about us without us. There's so much more to say in this area, and I've put up some contact details and would love to hear from others who might want to continue the conversation.